example of where saying no is perhaps crucial. Either saying no completely if you're not confident enough as a practitioner, but where treatments are just not really approachable, and matching that expectation with what's achievable. But where an organisation like Safe Face can really help you find practitioners that know what they're talking about, that have the experience and the training and are delivering the results to a standard that you would expect. I think that's very important, don't you?
Around the eye is such a high-risk area that I would always advise anyone seeking treatment to make sure you are seeking treatment with an appropriately qualified medical professional, be it a doctor, nurse or dentist. Do not go to beauticians, do not go to beauty therapists, do not go to anyone who doesn't hold a medical degree of some sort. Because if that goes wrong, then it can mean some serious problems.
Well, I don't want to be too tabloid in my approach to this, but of all the horror stories, it tends to be in this area that they most occur. Can you just talk through some examples of, some of the worst problems?
Well, the worst problems are usually associated with getting the filler into a blood vessel. Nerves usually regenerate fairly well if you damage a nerve, but if you get the product into a blood vessel, it can block the blood vessel, and wherever the blood that was in that vessel was flowing to no longer gets a blood supply. So I've certainly seen cases where the nose has gone gangrenous, the lip has gone gangrenous, and there are even cases now, most of them in the Far East, where they're doing a lot of high volume treatments to westernize noses, where the blood vessel has actually not only been blocked by the filler, but the filler has actually travelled to the eye and caused blindness. And there's well over 100 cases been described worldwide now, blindness due to filler injection, often in an area not close to the eye. There was a case only a few weeks ago with a lower lip being injected. 5 minutes later, the patient was blind.
So that's a very sobering thought, but it's not an exaggeration, is it? And that, I think it's really important to say two things. First of all, it could happen to any one of us. With all the best will in the world, all the most, the best experience, these things can still happen, and that is a risk that you take on when you essentially sign up for a treatment. That having been said, you can minimise those risks. There's a lot that patients can do in the homework and the groundwork and the back checks. There's a lot that Safe Face does for patients, but I think the patient should still check that Safe Face has indeed done that. That's really important. And there's a lot that we as practitioners can do, either by just avoiding the area completely, like the coward I am, or actually, by making sure you are practicing safely.